Every single week, one tiny molecule changes how your body fights diabetes. This is the true science-backed story of trelogliptin and the hormones it controls. Inside your pancreas, a hidden hormonal war decides your blood sugar every single day. Today we go microscopic to see exactly how it's won. You'll see the real hormones, the real enzyme, and the real clinical data behind this once-weekly diabetes medicine. Stay to the end for the full picture.
Type 2 diabetes happens when the body loses precise control of blood sugar. To understand the fix, we first need to meet the hormones responsible.
Inside pancreatic islets, gold beta cells make insulin, while red alpha cells make glucagon. Together they form a constant tug of war over your blood sugar. After you eat, your gut releases two powerful hormones, emerald green GLP-1 and electric blue GIP. Scientists call them incretins, the body's natural sugar regulators. GLP-1 and GIP travel through the bloodstream straight to the pancreas. Their mission: tell the beta cells exactly when to release insulin. When GLP-1 binds the beta cell, it triggers a golden cascade. Insulin floods into the blood, ready to move sugar out and into your cells. Insulin unlocks the doors of muscle, fat, and liver cells, pulling sugar out of the blood. This is how a healthy body keeps glucose in perfect balance. But there's a saboteur. An enzyme called DPP-4, glowing violet, hunts down GLP-1 and GIP, destroying them within just minutes of release. In type 2 diabetes, DPP-4 works overtime. Incretin hormones vanish before they can trigger enough insulin, and blood sugar stays dangerously high. Enter trelogliptin, a once-weekly tablet engineered to stop DPP-4 in its tracks and let the body's own hormones do their job again. After swallowing, trelogliptin dissolves and enters the bloodstream, traveling directly toward the DPP-4 enzymes waiting to destroy your hormones. At the microscopic level, trelogliptin fits precisely into the active site of DPP-4, physically occupying the exact spot the enzyme uses to cut hormones. This is called competitive non-covalent inhibition. Trelogliptin blocks the enzyme without permanently damaging it, letting GLP-1 pass through unharmed. Trelogliptin binds slowly and holds on tight, with a dissociation half-life near 30 minutes, giving it unusually long, sustained enzyme blockade. With DPP-4 blocked, GLP-1 and GIP levels rise and stay elevated for longer, exactly what the body needs to properly control blood sugar. Laboratory research shows trelogliptin inhibits DPP-4 about 4 to 12 times more potently than allogliptin and sitagliptin, two other common DPP-4 drugs. Sustained GLP-1 keeps knocking on the beta cell's door, activating internal signaling and driving a stronger, steadier release of insulin. Crucially, this insulin release is glucose-dependent. It only ramps up when sugar is high, which is why severe hypoglycemia is rarely a risk. At the same time, GLP-1 suppresses the red alpha cells, closing the gate on glucagon, the hormone that normally raises blood sugar. Less glucagon means the liver releases far less stored sugar into the blood, cutting off one of the body's biggest sources of excess glucose. GIP works alongside GLP-1, especially after meals, amplifying insulin secretion further, a synergistic hormonal team effort to manage blood sugar. GLP-1 also slows gastric emptying and increases fullness, smoothing out how quickly sugar from food enters the bloodstream after eating. More insulin, less glucagon, less liver sugar, slower digestion, together these effects flatten the dangerous blood sugar spikes of type 2 diabetes. Human studies show more than 70% of DPP-4 activity stays blocked a full week after one dose, the science behind once-weekly dosing. In 24-week clinical trials, trelogliptin monotherapy lowered HbA1c by about 0.33%, without significant weight gain or hypoglycemia. Fewer pills mean better adherence. 52-week studies confirm sustained control, whether used alone or combined with other diabetes medications. Trelogliptin, also known as Zafetec, was developed and approved for clinical use in Japan as the world's first once-weekly DPP-4 inhibitor.
None of this exists without pioneering researcher Dr. Jens Juul Holst. whose decades of incretin research uncovered how GLP-1 controls blood sugar.
Dr. Daniel Drucker's research further mapped GLP-1 biology, laying scientific groundwork for the entire class of incretin-based diabetes therapies. One molecule, one enzyme, 4 hormones, one beautifully coordinated system. This is the real science of how trelogliptin supports blood sugar control. Remember these key facts. It blocks DPP-4, raises your own natural hormones, works only when sugar is high, and needs just 1 dose a week. As always, this is educational content. Talk to your doctor before starting, stopping, or changing any diabetes medication. If this helped you understand your medication better, subscribe and hit the bell. New science-based diabetes videos drop every single week.